In election campaigns, health is huge in every way. It's always near the top of voter concerns. The sheer scope of the way it touches all of our lives is unlike any other part of government. Bulk billing, mental health, aged care, NDIS, rural health, private health insurance, waiting lists. It goes on and on. Australia's Medicare system of universal health care is popular, and that's why you're seeing this on the campaign trail.
At this election, this little card here, your Medicare card, is what is at stake.
Your say is telling us Australians want Medicare to work, and they're also telling us where they think it isn't. So let's take a look at a few, and we'll start at the top. Bulk billing. Bulk billing is at the core of what it means to have a universal healthcare system, that you shouldn't have to pay to see a GP. But finding one has been getting harder.
There are times when my husband or I are unwell but have had a tough month, so we can't afford to go to our GP and pay $48 for a visit.
Last year, 78% of doctor visits were bulk billed, but that's down from a high of nearly 90% 5 years ago. Bulk billing is highest in low-income areas where it should be, at rates of nearly 90%. But it can still be difficult to find, especially in the bush.
My regular doctor who used to bulk bill me has moved cities. The other doctors at the practice won't do it. That leaves me short of food on the fortnights I need script renewals.
So what's on offer? Well, Labor has promised $8.5 billion to Medicare, which it says is the single biggest investment in Medicare since it was created in 1984. Now, that'll go towards a target of 90% bulk billing by 2030. There's more incentives for doctors to bulk bill their patients, money to train more doctors and nurses, and more urgent care clinics will be opened. Doctors say it still won't be enough to reach that target of 90%. Now, Labor's also committed $573 million for women's health, and it's promised to cap the price of medicines at $25. The coalition quickly matched Labor's promises on Medicare, women's health and medicines. The Greens are pitching a massive expansion of Medicare, nearly $200 billion over 10 years, to fully include mental health and dental care into Medicare for the first time. So let's go there, because your say contributors certainly have been.
If the government is serious about reducing the cost of healthcare in Australia, they need to introduce universal dental care to all Australians.
It's been coming up a bit, and the Greens have been going hard on it.
Dental into Medicare!
But dental doesn't get a mention in the health platforms of either Labor or the coalition. As for putting dental into Medicare, Labor says one day.
Of course, it makes sense to have the entire body covered by a universal healthcare system, including the mouth. Our party has as a platform commitment at some stage bringing oral health or dental care into Medicare. The priority is rebuilding general practice, driving up bulk billing rates again to see your GP.
But the major parties have a lot more to talk about on mental health, and your say contributors do as well.
What are both parties doing about the mental health crisis in this country? It's expensive and out of reach for most ordinary Australians to get into the system.
Labor has pledged $1 billion for mental health services. That includes 31 walk-in Medicare mental health centres offering free and immediate mental health support, and there'll be more mental health professionals trained. The coalition is promising to increase the number of subsidised mental health visits from 10 a year back up to 20, which is where they put it during COVID. But the coalition's big pitch is $400 million specifically targeting youth mental health.
We desperately need to invest in the mental health of young Australians. This is a tipping point.
The coalition says it wants to put Australia at the forefront of youth mental health treatment in the world. Now, that means services for what experts call the missing middle. It's young people who are struggling with anxiety, depression, eating disorders or the like, who need more than what the local clinic can provide, but don't yet need full hospital care. The coalition plan is to expand early psychosis youth services, expand the National Centre for Excellence in Youth Mental Health, and expand the capacity of existing Headspace centres. Those offer free mental health support for 12 to 25-year-olds. Labor is promising $500 million for 20 youth specialist care centres. It's also promising to build more Headspace centres. The Greens say they'll make mental health care available through the public system under Medicare without any gap fees. And neither major party is talking about that.